So my goal today with you is to give you a clear and unequivocal perspective on marijuana and what it's doing to our children, specifically to their brain development, because that's one of my areas of expertise and my biggest concerns when it comes to this drug. So the psychoactive ingredient in marijuana is THC. And back in the 1970s, the marijuana that was smoked had 1% THC. Very, very, very small amount of THC. And then the average potency started to increase from that point going forward. So in 1985, the potency was closer to 3.5%. And by 2006, it had gone up 175% at 8.8% THC in an average sample of marijuana. That is, in this day and age, low. We're seeing samples of marijuana closer to 30–35%. And then the kids are also starting to do what's called dabs. You guys familiar with dabs? Dabs is a very concentrated form of marijuana. It has 90% THC. 90%. This is like, if you do dabs, you don't function. It's extremely potent. So the potency of the marijuana today is causing havoc, because what's happening is, because of that potency, the kids are becoming addicted. And we'll talk about addiction in a second. How do we know that? The way that we know that is because the admissions to treatment centers for marijuana abuse and addiction have gone up exponentially. So let me give you a few statistics associated with that. Between the years of 1992 and 2006, there was a 188% increase in individuals that were being put into treatment programs due to marijuana abuse. So it went from 22.7% to over 65% of the people that were being admitted to treatment programs had abused marijuana. In terms of marijuana addiction, the percentage is off the charts. 492% increase in the proportion of treatment admissions for people under the age of 18 who are addicted to marijuana. If this isn't an issue, then I don't know what is. So how available is it, right? We need to talk about how, can these kids get their hands on marijuana? Within a day or an hour, it's super available. In fact, in 80% of the high schools, the students can get their hands on it that quickly, and in as much as 44% of the middle schools, the kids can get their hands on it that easily. Mean age of initiation. So kids start smoking on average around 14 years of age. So 14 is 8th, 9th grade. That's the mean age of initiation. The earlier you start to use marijuana, the greater the risk that you're going to use other drugs as well. By 10th grade, 31% of the students on average have tried marijuana, and by 12th grade, close to 50% have tried marijuana. That's 2 in every 5 students. So what are the risks? Well, first of all, knowing where the boundaries are with marijuana and whether or not we should allow our kids to experiment has been confusing. It's been confusing for all of us. We need to all admit that. But it's becoming not confusing at all. And actually, the answer to all of this is very clear. There should be a no-tolerance policy. And you're going to understand why in a second when you hear the effects of marijuana use at these early ages. All right, so first thing I want to talk about is this confusion or this conversation we continue to have about whether or not marijuana is addictive. Marijuana is addictive. So diagnostic and epidemiological and laboratory and clinical studies have clearly indicated that marijuana is addictive and it causes harm. 1 in 6 who smoke marijuana in adolescence are going to become addicted, and 1 in 9 who smoke in adulthood are going to become addictive. As important as this question is, it's really a moot point, because the effects that marijuana have on brain development are so significant that whether or not it's addictive is just not important. It is indeed also a gateway drug. A gateway drug, by the way, just to define it, because people have many different definitions of what a gateway drug actually is. It's a habit-forming substance whose use may lead to the abuse of drugs that are more addictive. That's a gateway drug. Marijuana is indeed a gateway drug. Will all kids who use marijuana become addicted and use other drugs? No, they won't. But do we want to take the chance as parents and clinicians? I don't think we do. I'm going to give you a quick lesson on brain development. It's painless. It's not going to be overly technical, just to give you a perspective on what's going on in the brain during these periods of time. And then I'm going to talk to you about two seminal research projects that have just recently been out that are going to educate you on how marijuana specifically affects the brain. So there are three primary aspects of brain development during childhood. There's proliferation, there's thickening of the gray matter, and there's pruning. And all of these have to do with what the nerve cells are doing at any given time. So I'll define each of those, and then I'm going to tell you from birth to mid-20s what goes on in terms of brain development. So pruning, well, let's talk about proliferation first. Proliferation is when the brain grows a bunch of new nerve cells. Thickening of the gray matter is when the brain is learning. That's just like learning. So it's just like a tree that has branches and leaves and roots that dig down. That's what the brain is doing. It's building connections when it's thickening the gray matter. And then when it's pruning, it's actually killing off brain cells. Believe it or not, our brain does do that. So here's what happens. When a child is in utero, they go through a period of proliferation to get ready to be born and to enter the world and start to process all the stimulation in their environment. Then once they're born, the gray matter starts to thicken, right? They start to learn. They start to distinguish between what's a dog and what's a cat, and they learn how to walk and they learn how to talk. That's all the thickening of the gray matter. We thought that then the brain was going to be relatively fully developed by the time an individual was in their teens. Well, we know that is not the truth, because what happens now is prepubescent, like right around 10 or 11 years old, the brain goes through another period of proliferation. It actually grows a bunch of new nerve cells at that point in time. Very exciting, right? Then puberty hits and something really interesting happens. The brain starts to kill the brain cells off again. So any of the brain cells that are not being used or being used in ways that they shouldn't be are going to die. So here's what we know. We know that the way that you use your brain during this period of time is going to determine, because you're hardwiring your brain during your adolescence. And how your brain is hardwired during that period of time is going to dictate the brain power you have throughout the rest of your life. So it is a critical period of brain development. And what's happening during this period of time? Kids are experimenting, right? And kids are getting addicted. And these have a permanent effect on not only the physical structures of the brain, but also the behavioral aspects associated with those physical structures. It is also interesting that the parts of the brain that are affected by marijuana use are also the parts of the brain that are the most important to our higher order thinking. So the hippocampus, which is like your central processing unit, the prefrontal cortex, which allows you all your higher order cognition, your amygdala and your nucleus accumbens, which are the emotional centers and the reward centers of the brain. So interestingly enough, these areas of the brain also have the highest concentration of THC receptors. So when you smoke marijuana, those areas of the brain are the areas that attract the THC. And those are the areas of the brain correspond to particular abilities. Things like impulse control, planning, decision making, working memory, the allocation of attention, the ability to sustain your attention, memory. These are critical areas of the brain. What I see with the kids who have been smoking pot during these periods of time, they can't plan. They can't set goals. They can't follow through. They can't pay attention. And oftentimes you'll get them in your practice and you'll think, well, do they have ADD? Do they have ADHD? All of a sudden the diagnoses become incredibly complicated because marijuana use can also mirror things like depression, anxiety, ADD, ADHD. Oftentimes when I get these people in my practice, they'll be on medications for these things, and they'll be smoking marijuana, and they're not functioning, and the parents want me to do something more with them. I say, I don't even know what's going on. I can't even sort this out. It's too complicated. All right, so two seminal studies that back up the effects that marijuana is having on brain development. One came out of Duke University back in July of 2012. A very, very well done study. It's a longitudinal study. These studies are not easy to do. They're very expensive and time consuming. What they did was they took 1,037 people. They tracked them over the course of their lives from childhood until they were about 38 years old. And every year they did assessments on them, full neuropsych assessments to determine how their cognition was moving along. They separated them out into those that used marijuana at the early ages and those that didn't when they were analyzing the data. And here's what they found. They found that those individuals who were persistent marijuana users, and persistent marijuana users were defined as those that smoked 1 to 3 times a day, 5 to 7 days a week, showed up to a 6-point drop in IQ. And that drop was permanent. So we believe and we know that the brain has plasticity. It's plastic. It heals from a lot of different things. If you have a stroke, you can get some of your function back by just using your brain. So to say that the IQ drop is permanent is really significant. What it means is that during that hardwiring, the brain hardwired in a way that cannot be changed. It cannot be switched with any intervention of any kind that we know of at this point in time. There were also significant impairments in these individuals, those that started smoking marijuana in their adolescence and smoked through that period of brain development. There was significant effects in their ability to plan, to make decisions, to store information in long-term memory, to retrieve information. Their short-term memory was affected. They also found a very high correlation between marijuana use at these ages and the incidence of psychotic disorders like schizophrenia. So, and that, I would suggest to you that we take that finding with a grain of salt at this point in time, because there's not a lot of data to back that up yet, but the correlation was quite strong. What they do with these studies to ensure that the results that they're getting are relatively accurate is they take a lot of other variables out of the data. So they did things like they took age out of the data, they took education level out of the data, they took socioeconomic status out of the data. They stripped the data down so that they could determine that marijuana use during that period of brain development was indeed not the cause, we can't say, because that's not the type of research that was done, but that the correlation was true and reliable, and indeed they found it was, and it was very robust. There was also another seminal study that just came out in April of 2014, and it's out of Northwestern University, Massachusetts General Hospital, and Harvard Medical School. Now, this research is particularly interesting because most of the research done is on individuals who smoke marijuana to a significant degree. So they're smoking every day, 5 to 7 days a week. This study looked at recreational users. So those users that only smoked once a week, twice a week, I mean, these are individuals that are just using it recreationally. They're not abusing it. They're not addicted to it. And what they did was they compared the brains of 18 to 25-year-olds who reported smoking marijuana at least once a week and those who had little or no history of smoking marijuana. So we're also looking at an age group 18 to 25. It's during this period of time that the prefrontal cortex is still pruning itself. Women's prefrontal cortex tends to prune itself into the early 20s, and men's continue into the mid-20s, sometimes into the 30s, all right? And sometimes into the 50s, 60s, and 70s. In fact, yeah, they just keep pruning in the prefrontal cortex. And here's what they found. They found that the nucleus accumbens, which is a brain region that's known to involve reward processing, was larger and altered in shape and structure in the marijuana users. So there was a physical structural difference in the brain compared to those that didn't smoke marijuana. They found similar results when they measured the amygdala, which plays a central role in emotional processing and impulse control. And what they concluded was that light to moderate use of recreational marijuana can cause changes in brain anatomy. And in fact, the greater the marijuana the use, the greater the abnormalities. In fact, because of the potency of the marijuana that's being smoked today, even after you stop smoking marijuana, so for example, let's say you're not an abuser, you're just a recreational user, it can take up to 28 to 38 to 48 days for the effects of that marijuana use to dissipate. So if you have memory issues because you just smoked marijuana last night, you may indeed have memory issues and information processing issues for the next couple of months. So it's not the kind of drug that you take and that dissipates and it's out in 24 hours. They're finding that as well. A couple of other physical effects that marijuana have that are really important. Marijuana smoke contains an equal amount of tobacco and tar as cigarettes do. And it contains up to 50 to 70% more carcinogens than cigarettes do. I had a father tell me, look, I'm just really glad that my son is not smoking cigarettes. And I said, really? Is that right? Well, let me just tell you the truth about this. What this results in is a much greater tar buildup in the lungs. So one joint is equal to 5 cigarettes in terms of obstructing airflow. It also causes an increase in your heart rate, which is usually not a problem for people that don't have a heart condition. But if you don't know if you have a heart condition, smoking marijuana can be very dangerous, and that's in children or adults. I had a mother who came to one of my lectures who has a son who has a heart condition, and she's terrified that he's going to smoke marijuana. And that increase in heart rate lasts 2 to 3 hours, and it increases the volume of the blood flow through your system. I mentioned the apparent relationship or correlation between psychotic disorders and marijuana use. There's also increased evidence, obviously, of co-occurrence of a lot of different conditions. So there was a study done, they took a sample of 600 12 to 18-year-olds who are dependent on marijuana, and they found that 74% had conduct disorders, 77% had ADHD, 37% had severe depression, and 28% had severe anxiety. So here's where it gets really complicated, as I mentioned earlier. When you have a marijuana user, it's really hard to sort out what's causing what. And you really need to clean the whole system out before you can diagnose what's going on. Oftentimes these kids start smoking marijuana because they have ADHD or because they have Tourette's or because they're anxious. And what marijuana ultimately ends up doing is exacerbating all of those conditions. It also increases the risk of other drug use. Drivers under the influence of marijuana are twice as likely to get into a car accident. And for teens and inexperienced drivers, the risk is even higher. This is becoming a huge issue now in Colorado. They've seen, they're touting the fact that their revenues are going up and their crime is going down and their motor vehicle accidents are going up. So substance abuse counselors call marijuana the mañana drug. You guys know what mañana means? It means tomorrow, because the kids and adults who smoke marijuana on a regular basis are more apt to do everything tomorrow, and tomorrow never comes. So this is a huge clinical issue when you're working with individuals who are marijuana users, because they'll sit there and they'll say, yeah, that's good, that's a good idea, I'm going to go do that. Yep, I'm doing that, yep, and they never do much of anything. So It's challenging enough to get teens and young adults to follow through, but you add pot to the mix and you've got a really difficult situation. The last thing I want to say about development in terms of marijuana use is also, I think, is as important as the brain development aspect. And that is that kids that use marijuana rob themselves of the developmental milestones that they need to be responsible adults. So they don't have the grit and the perseverance to push through difficult times. They haven't learned to depend upon themselves. They haven't learned that they're capable. And when they reach adulthood and don't have these skills and don't have the self-esteem, it becomes extremely challenging for them to meet those developmental milestones in adulthood. And that's, in my practice, I find that to be, in addition to the others we've talked about today, one of the more challenging things to deal with, is how do you grow them up at that point in time? Very, very difficult. Okay. So what do we do? I just have some really, pretty straightforward suggestions. And some of these are for parents, but they also, I think, will apply with the clinicians in the room as well. We need to educate our kids and ourselves. We need to set expectations and consequences. So, sit your kids down. What are your family values? Are you going to take a no-tolerance approach to drug abuse? And if you are, how are you going to implement that? And if the kids do use, what are you going to do about it? They need to know about that up front, right? You need to have these conversations with them. I am a proponent of drug testing. I think in this day and age, it should just be part of reinforcing your family values. You should start drug testing. If you have a kid that's at high risk, start drug testing in middle school and just make it a random drug test that you use throughout a child's development. Here's why I suggest this to be the case. And I'm not saying that it's the right thing for every family or every kid. But here's what it does. Two things. One of our challenges as parents is, during this stage, is to let go, right? Somehow we have to start giving our kids the room to mature and grow up. And there's a lot of risk out there, and we're terrified of that. So one of the ways of doing that is to have an ace in the hole like this. You're not going to drug test your kid every week. You may not even drug test your kid more than once a year, but you always have it there if you need it, because it's so much easier to deal with this issue if you catch it in the early experimental stages. And you think you're going to know that your kid is smoking marijuana, and I'm going to tell you right now, you are not going to know they're smoking marijuana. They are clever. The marijuana these days, they can walk in high, you can't really tell what's going on. So the other thing it does is it gives the kids an opportunity and a way of saying no. Because if they're in a social situation and it's being presented to them, they can say, nah, my parents are assholes, they drug test, I'm not doing it, all right? If you can get your child to the age of 21 without having abused alcohol or drugs, it's more likely they never will. So that's the reasoning behind that. You can get drug tests at drugtestyourteen.com, and you can test for everything. You can test for alcohol use, you can test for opiates, you can test for marijuana. So some other things you can do, make sure you follow through on the consequences that you set in place. Look for signs and monitor technology. Know your kids' friends and families. If your kid is normally hanging out at your house and you've got your ping pong table and all of a sudden they're going over to Joe's house and they're over Joe's house like all the time and they never come to your house again, it may be that those parents are allowing the kids to smoke marijuana at the house. So just know your kids' friends and families. Intervene early. And if you're late in the game, if your kids are already using, don't hesitate to intervene now. Otherwise, it's going to, well, you guys all know, right? It's going to be a mess. As serious as this topic is, when you're dealing with it as clinicians and in a family environment, make sure that you use humor, make sure that you lighten it up as you deliver some of these very potent and important messages. So in summary, parents, teens, and young adults are not getting a clear message about the effects of substance abuse on development. And the most powerful way for these kids to hear that message is through the family. We all do everything we can to get it out. We all have our data, we all have our brochures, and that's necessary as well. But the message really has to come from the family. Parents need to stay hands-on in their daily lives, and they need to establish family values and boundaries and standards of behavior. So I want to leave you with a few inspiring words from St. Francis of Assisi, because this is a big problem. It's a big issue, whether you're dealing with it at home or whether you're dealing with it in the course of a community, and it's complicated. So what you want to do first, just do what's necessary. So as clinicians, as parents, think about what's necessary in this situation with kids and drug use. Second, once you've done that, do what's possible. And once you've done what's necessary and you've done what's possible, before you know it, you'll be doing the impossible. And in this case, the impossible is actually setting realistic and healthy boundaries for our kids so they don't become addicted to marijuana or any other drugs. So thank you.